Hey guys, Nick with Active Therapy. I have Abby here who's a speech therapist. We get a lot of questions all the time about various things. So we're going to start a new segment today. It's going to be called Ask Active Therapy. So one question we get a lot is, what is speech therapy? So Abby's going to take that for us.
So the easiest way to explain speech therapy is to break down my name. So I'm called a speech language pathologist. So the first thing is the speech part. Speech is anything that comes out of your mouth. So any sounds, it can be words as well. So it's anything that comes out. That also affects like voice, so how those sounds are being presented. The next segment is language. So language puts meaning behind the speech. So are you making complete sentences? Are you combining those words correctly? Things like that. Language can also mean different things besides just verbal language. It can be sign language, body language,
Sure.
All sorts of things like that. And then the pathology part goes into what's going on in the brain and how's that affecting your speech and your language. Some other things we also work on is cognition. So that ties into the language part and the speech. Is your brain able to tell your mouth what to do? We also work on swallowing. So if somebody, usually you see that more in adults, like if a stroke happened, are you having trouble eating and drinking now? Are you at risk for developing aspiration pneumonia, which can put you in the hospital and really set you back?
Perfect. So that's a great explanation. That's why we ask an expert to explain it instead of me. The next thing we're going to see is, what should parents or family members see in kiddos, their children, or even up to adults? Why would they possibly need speech therapy?
Okay. So one thing is, if your kid is talking, so they're at talking age, and a lot of people don't understand them, but mom and dad might really understand them, and they constantly are kind of translating for their child.
Sure.
That's kind of a red flag. If your child is not talking and they should be talking, they're at that age where, they're just not really talking yet, they're really kind of late, they're a little bit behind. It's better to get in and get screened than to try to just wait and put it off.
Sure.
Some other things are, if your child doesn't have good friendships, like they struggle to make friends,
Sure.
That could be something as well. With adults, it's more if there's changes that affect your daily life.
Okay.
So if you used to be able to do something and now you're like, I kind of struggle to do that, or you're noticing your parents, mom used to be able to do this and now she keeps forgetting, or in the same conversation she's repeating herself and she's not really making a lot of sense. That might be something like, hey, something underlying might be happening. And then of course the big things, like if you had a stroke, or
Right.
if anybody had a fall for traumatic brain injury, things like that.
Sure. That's great. So if you are noticing your kids or possibly your parents, maybe adults are experiencing some of these things, the best thing to do is to get in, get screened, see if this is something that could be beneficial. So if you notice anyone in your family or a loved one, a friend, that possibly needs speech therapy, please give us a call, 402-932-2888, or message me here, ask any questions that you guys have, and we'll make sure Abby answers them. She's the expert. All right, thanks guys, we will talk to you soon.